Yes, good afternoon. I'm by name Emmanuel Benson, the radiographer Emmanuel Medical Centre. I'm here to talk about radiology department as far as Emmanuel Medical Centre is concerned. Per the radiology, we have two modalities at the moment. That is the ultrasound scanner and the X-ray conventional radiography. If I'm talk about the first, that is the ultrasound, there are various examinations and procedures that we do as far as ultrasound is concerned. We do pelvic scans, that cuts across men and women. We do abdominal, that also cuts across. We do transvaginal scan, that is specific to women. We do Doppler, that is to the vessels, to rule out vessel infection, clots, to mention but a few. We do musculoskeletal, this is to look about muscles, joints, and we also do superficial scans. Later on, we'll also bring in a 3D scan. This is specific to pregnant mothers in cases of when we are trying to look at the anatomical growth or anatomical deficits in fetuses. So the type of examinations we do as far as ultrasound is concerned. And then we also have the fertility scans that we do, and this cuts across pelvic and transvaginals. Yeah, now to mention about a few examinations that are common, because in the setting we always have those common examinations or common scans that are performed on our patients. We have pelvic and obstetrics. These are the major scans that are done at Emmanuel Medical Centre. For pelvic, a patient comes in with complaint of low abdominal pain. Some come with persistent bleeding, spotting. All those we do pelvic ultrasound. Now, to be specific, in pelvic evaluation, usually the gold standard is a transvaginal. A transvaginal scan is very sensitive and gives a broad or clear images of the assessment of the pelvis. It really rules out structural abnormalities and pathological changes as far as the pelvis is concerned. This is also important in fertility cases. You know, as of late, many women have issues with fertility, and when they come to our facility, we try as much as possible to look at the pelvis, look at the gynecological setup, structural abnormalities, and with all this, we use the transvaginal, which is very sensitive and gives us correct results. You can never go wrong with it. I will talk about the other modality, that is the X-ray part. Here we do conventional imaging. We do many X-rays, many examinations, whole body. We have skull, chest, conventional, talk about them. These help us in the diagnosis and better management of our patients. Now for the 3D that we want to bring in as we move on, 3D is good in cases of superficial pathology. When we are doing a 2D scan on our fetuses and you happen to come across an abnormality that you want to look at in details, you can employ a 3D and it will give you a clear image or a 3D picture that is easy to explain to the mother such that they are well versed with what is happening. 3D can also help us in looking at the facial structures. You know, fetuses have, there are those facial deficits or abnormalities that come in as the baby grows. So if you suspect a cleft lip or palate or nose proboscis on a 2D, you go ahead and do a 3D. A 3D will give you the 3D dimension of that abnormality, and it is easy to pick it up and explain it to your patient, which helps in reassurance and knowing on the diagnosis and management. So basically, those are the two modalities we have in the radiology department, and with the high-tech, those are the two radio. We also have we have the ECG machine that helps us in doing echocardiography, an echogram, which if we see an abnormality, we go ahead and request for an echo ultrasound. So there's always a question on our mothers as far as when, especially obstetrics or early pregnancy, when do I do the first scan? And as far as from practice, the first scan can be done as early as 4 weeks. We always do a pelvic scan. If that is not conclusive, we go ahead and do a transvaginal scan. A transvaginal scan can detect pregnancy as early as 3 weeks of amenorrhea. So that question of when can I do the first scan, I think as far as 4 weeks we can do the first scan, because it has advantages. One advantage is you can know how many sacs or how many pregnancies you have. So that is also important. And then you can also know the location, because we've seen ectopics, know the location where you have the sac. This helps us in ruling out ectopic and the normal pregnancy. Then there's also a question mothers usually ask, how many scans am I supposed to do? Yes, during the course of pregnancy. At least 5 ultrasound scans, because the first will give us what we call location, then the second will look at dating, the other will look at abnormalities, that is trisomy 21 or Down syndrome. That is the third scan around the 12th week or 13th week. Then we have anatomical survey. That one you look at the genital growth of the baby, look at the genital anomalies, look at their genital body structure, the fingers. Each hand should contain at least 5 fingers. You look at all those to rule out any deficits. Then the other we do as the other 2, fetal well-being, and finally you do biophysical profile. So those are basically the number of scans you can do. There can be more basing on the condition. Then another question that we usually get is ultrasound really safe in pregnancy? Yes, ultrasound is safe in pregnancy, provided you put the ALARA principle in play. ALARA principle works even in ultrasound. We also employ it in X-ray. You should keep as low as reasonably achievable. A mother shouldn't take long on the couch. Why? Because this machine uses electricity, and for it to generate that sound, sweep it through the mother and receive it back, there's some heat loss. So there is a belief, or there is research that says that the baby may be exposed to too much heat. That's why you have to reduce on the working time of this mother. So usually the critical moment as far as pregnancy is concerned is the embryological stage of pregnancy. There we have to be very critical. This mother shouldn't spend a lot of time on the bed, because you're reducing on the risk of the fetuses being exposed to the heat that the probes to the heat. So there's a research that says that heat may distort the chromosomal, may distort the DNA, and hence cause growth deficits in a child. So we have to put in so much emphasis and ensure that we are very smart and do this as short as possible to achieve our goal. If you do more than 10, I started by saying at least 5 scans during your obstetrics time. But there are circumstances when there are those things that come in. For example, walking and fell down. For example, a mother is on the maybe moving around and drops down and falls, and that predisposes the pregnancy to a risk maybe of placenta abruption, or any abnormality can happen. So there we justify you can do another scan or more. Or in cases where a mother all of a sudden starts bleeding, so you need to ascertain on the viability and the fetal well-being. In such cases, you can do more than 5 scans, but per WHO, at least 5 scans should be done during the pregnancy period. This helps the midwives, the physicians, and the doctors to really ascertain the integrity of the whole baby, of the pregnancy, and it helps in the antenatal care, because it's rare to miss out if you've done at least 5. So we recommend at least 5 scans per day. Embryological, this is, okay, pregnancy is broken into 3 parts. We have the first trimester, second trimester, and the third trimester. The first trimester, that is the embryology. Embryology means in Luganda is like when mwana watandika kutonda. You have the brain coming in play. So that is the part where the whole development starts from. Here we have the chromosomes coming in, the DNA. These are weak structures. So any slight distortion in the environment of the temperature or the environment of the baby can cause abnormalities. So any distortion in the temperature or in the structures of development, it may cause abnormalities during development and growth. So that is a very sensitive stage, and it is the stage where development starts from. Okay, I'm by name Simio Benson, the radiographer at Emmanuel Medical Centre. I thank you for listening to me. Thank you for the audience, and I hope we will continue from here on and update you on the radiology department as far as the Emmanuel Medical Centre is concerned.